If your stool comes out soft, mushy, or in broken pieces, there's usually just one of two reasons. Either it's not being made properly or it's not moving properly through your intestine. If you find the right reason, you'll stop needing to plan your day around a washroom. In this video, we'll go through how your family doctor focuses on improving stool shape. And if that doesn't work, how a specialist looks at three things to find out what's making your stool move at different speeds and what to do when it actually does. My name is Harsh and I'm an entrepreneur and scientific educator. I make invisible food problems visible. We go through foods, conditions, and habits and show you exactly how each one affects your digestion. This video is on IBS. The average Indian stool weight is 300 grams. 70% of this is water, 20% is bacteria, and 10% is fiber. If any of these ratios go off, stool can become mushy, broken, or just too hard. So when you go to your family doctor and you're told to eat more fiber, the doctor is trying to improve your stool shape. The advice is correct, it's just incomplete. Because what type to eat makes a huge difference. I'm not talking about soluble and insoluble. Our target is far more specific. So only two things matter. One, does that fiber gel inside your body? And two, can your gut bacteria eat it? Fibers that gel absorb water and hold on to it. That gel travels with your stool all the way to the end. So if your stool is too loose, the gel soaks up the extra water and makes it firm. And if your stool is too hard or dry, the gel is already bringing water with it and it can make that stool soft. So it works in both ways. It means that fibers that gel affect two parts of your stool, the water component and the fiber component. That's why it's a very strong fiber to have. Now, some fibers don't gel at all. Even gut bacteria can't eat them. So they come out almost exactly as they've come in. They just brush the walls along the way out, and that makes the stool mass much larger. Fibers in this box are also a strong candidate for you. It's because it's working on the fiber component of your stool. Next, a fiber that gels but your bacteria can eat it. Look, there's a trade-off because the gel is supposed to get to the stool, but your bacteria eat it before it can get there. So this doesn't help so much with the fiber and water component. It only helps with the bacteria component. That's why we categorize this as weak. And finally, those fibers which don't gel but your bacteria love eating them. In normal scientific terms, we'd usually call this a prebiotic because they help feed your gut bacteria. Again, it doesn't help with the water or the fiber component of your stool, only the bacteria, 1 out of 3. And so we give this a weak rating again. So look at the grid now. You've got 2 places which are strong and 2 which are weak. And you ideally want to consume fibers which fall into these 2 boxes. Interestingly, in 2007, researchers actually looked at more than 150 papers to answer exactly this question, meaning, does the theory actually work out in real life? They asked if you eat 1 gram of fiber of any food, how much does your stool weight actually increase? And the findings were quite surprising. Dal fiber, it doesn't gel but bacteria love eating it. So 1 gram adds just 1.5 grams to your stool weight. Pectin, the main fiber in fruits, it gels but again bacteria love eating it. So 1 gram adds just 1.3 grams. Isabgol, it gels and bacteria can't eat it. So 1 gram adds a surprising 6 grams to your stool weight. And finally, wheat bran. It doesn't gel, bacteria doesn't eat it. And so 1 gram adds an amazing 7.2 grams of weight to your stool. So the theory actually matches with what we expected. The 2 strong boxes seem to include the fibers that make the biggest difference to your stool weight and your stool shape. Now you're probably wondering where fruits and vegetables go, and this is where it gets a little complicated. Fruits and vegetables don't contain one type of fiber. It's usually a mix of 2 or 3. And that's why there's no direct answer for all fruits and vegetables as a whole. To solve for this, I've created a list of 50 fruits and vegetables broken down by these categories so you can make a better decision. You'll find the link to this list in the description below. I've tried to make it as easy as possible to help you decide what type of fibers will probably be best for you. So let me summarize. To improve stool quality, you need to improve 3 components: fiber, water, and bacteria. I've just shown you how to get the fiber part right and why feeding your bacteria for this purpose isn't the goal. If you had especially dry stool and you want to work on the water component, I've made a separate video that almost 300,000 people have watched. I'm leaving the link in the description and I highly recommend you take a look at that. A quick note before we go further. Most people watching these videos actually want to talk to a health professional one-on-one. The problem is they're not very easy to come by. And so we're creating one of the largest networks of health professionals with a history of dealing with clients with gut issues on gutwindow.com. If you're one such practitioner and have the credentials to back it, reach out to our team and we'd love to get in touch. The link to do so is below. Now, if you've put in all the effort, you're eating the right foods, and your stool quality still isn't improving, it's time we think about moving to problem number 2. Maybe it's not a stool shape problem, it's a stool movement problem. And this is where a specialist comes in. Because if your stool is moving too fast, your output will be liquidy, loose, broken. It doesn't get time to form. And if your stool is moving too slowly, the output will be dry, hard, constipated, because the stool is spending too long where it shouldn't. In India, the answer usually lies in 3 buckets. The first one is infection. It means you've had something contaminated, maybe food or water from outside, and something has come into your body which is causing a problem. Your gut tries to rush and flush this out, and this is causing a difference in stool speeds. Number 2, inflammation. You have 30 feet of gut, and a few feet somewhere is probably red and swollen. It's inflamed. This makes the gut irritable and unpredictable. This is why sometimes stool moves too fast and sometimes stool moves too slow. Bucket number 3, hormones. A signal that's coming from outside the gut that's telling the gut to move too fast or move too slow. Most professionals will start by trying to narrow down to the bucket to focus on. That's how they know where to investigate further. And they do this using just 3 things: a stool overview, a stool test, and a simple blood test. On the blood test, they're looking at markers like CBC, TSH, and celiac antibody. And on a stool test, they're looking at the stool overview, parasites, and calprotectin. Each number opens a bucket. And so let's start with infections. Infections are incredibly common in India. It comes when you eat or drink something contaminated and that pathogen has entered the body. If it's in the stomach, the infection can cause acidity and stomach pain. If it's in the small intestine, it can lead to gas, weight loss, or fatigue. If that infection is in the large intestine, it can lead to mucus or blood in stools. The telltale sign that your digestion problem is happening because of an infection is if your digestion problems have a start date. Meaning, if you know that the problems have started after a certain date or after a certain event, it's most likely an infection causing the problem. When a professional hears this, they'll usually start by looking at your stool quality in the stool overview section. If it's greasy, pale, floating, and has bad smell, no blood, it usually means the problem may be in the small intestine. So that's where they'll focus. On the other hand, if they find your stool is small volume but you go constantly, it's got mucus, a little bit of blood, there's some cramping in the lower region, in the pelvis region, then they suspect the problem might be in the large intestine. So they'll focus their efforts there. In India, 3 infections are incredibly common. 2 of them happen in the small intestine and 1 happens in the large intestine. So we'll start with one of the most common ones, worms. Roughly 1 in 5 Indians carries a worm right now. That's nearly 250 million people. India carries more worm cases than any country in the world. And that's because worms are everywhere in Indian soil. If you walk bare feet through a monsoon puddle, you eat unwashed vegetables, you don't wash your hands properly after using a public bathroom, it all creates a chance for the worm to get inside your body. Once inside, some worms burrow into your intestine walls because they're trying to feed on your blood. The symptoms which are most related to this is fatigue, iron deficiency because you're losing blood, and low appetite because you just don't feel like eating. You can catch this in your report using 2 numbers. Eosinophils and hemoglobin. Both you'll find in the complete blood count (CBC) section of your report. Eosinophils are white blood cells that start increasing when something is burrowing into your tissue. So high eosinophils is a sign that worms may be present. Combine this with low hemoglobin because worms feed on your blood and you're almost entirely sure that the problem causing your digestive issue is a worm infection. Even the most basic blood reports have these 2 numbers, eosinophils and hemoglobin. So if you've done your blood test recently and you're facing digestive issues, pause this video right now and go bring your blood report. check if these two numbers are high because you'll immediately know what you need to investigate next. If doctors suspect a worm infection after looking at your CBC and your symptoms, the next immediate thing they do is they ask for a parasite test. This is a stool report. Experts will look at your stool under a microscope looking for worm eggs or worms. And if they find it, then deworming is a simple, straightforward process. I've covered the technique and how to rebuild your iron reserves in a separate video. That video's link you'll find in the description. On to the second most common infection. And this infection is a very unique telltale sign. People with it usually can't eat or digest dairy or milk normally. Meaning if they take it, they'll get a lot of gas or start feeling uncomfortable. Your intestine has little fingers which help to absorb food. This infection flattens those fingers. One South Indian study showed that nearly 1 in 10 people living in Indian cities can actually have this. And because it doesn't touch blood, your blood report will look completely normal, but you'll probably complain of things like watery diarrhea, foul smell from your stool, abdominal cramping, poor appetite. And if the infection lasts for much longer, you'll start seeing things like unexplained weight loss, low B12. It's called Giardia. And the only way to catch this is a stool parasite test. Not 1, but 3. Because this parasite doesn't shed daily, you need to maximize your chance of actually catching it when it does. So 3 separate stool tests on 3 separate days will actually give you the result of whether you have this or not. Now onto the colon parasite. This one is linked to small frequent stools that usually come with a lot of mucus or a little bit of blood. When it enters the body, most varieties will just pass through. It doesn't affect a lot of people, but some varieties will stick to the gut wall and start trying to break it. And all the mucus protecting your gut lining, that breaks with it and shows up in your stool. Cases rise during monsoons in particular, or when people start drinking unfiltered, untreated drinking water. This is called amoeba. Interestingly, there's 2 types of amoeba, one good, one bad, and they look almost exactly the same under a microscope. It's like twins. So you need to ask for the test which checks this parasite's proteins, not just its shape. The list of infections and what to do is endless. And if you want to know more about whether you have an infection or what to do if you're detected with one, or how to recover after you've let the infection go, I recommend you look at a completely separate videos of ours called Infections Explained. Side note, one of the most common infections in India, I think the most common infection in India, is an H. pylori infection. And I made a very long detailed video on that alone called H. pylori Explained. So if you have that, I highly recommend you watch. On to bucket number 2, inflammation. If you open your gut, it's roughly 30 feet long. And it's supposed to be pink, smooth, soft. But if anywhere you see that it's becoming red, hard, swollen, that's what we call inflammation. If that inflammation is in your food pipe, we'll call it esophagitis. If that inflammation is in your stomach, we call it gastritis. If that inflammation is in the small intestine, we call it enteritis. And if that inflammation is the colon, we call it colitis. Inflammation normally happens because of 4 major activities. And the 4th one may actually surprise you. It's also very, very common in India. The first one is too much alcohol. The alcohol can irritate your gut lining skin and cause inflammation. The second one, interestingly, is painkillers. Inflammation is a side effect of having too many painkillers without doctor supervision. Number 3 is an infection. We just spoke about this. Some infections are trying to burrow into the walls of your intestine, and that makes that place red instead of soft and pink. And number 4 is foods. Some foods can actually be inflammatory for you. And one of the biggest categories of food that does this in India, surprisingly, is wheat. Your gut has a little repair crew, tiny helpers whose job is to patch up the wall when it gets scratched. One of these helpers is called TTG. When you eat wheat, the helper picks up a part of the wheat just to tidy it away. In most people, nothing happens. But in some people, the body's guards look over and they see the helper holding the bread and they get confused. They think the helper is the bad guy. So the guards attack their own repair crew. Now the wall keeps getting scratched and nobody's left to fix it. This is called celiac disease, and it comes with loose, greasy or pale-looking stool, bloating and gas, abdominal pain or cramping, and weight loss despite eating normally. In North India, studies show 1 out of 100 people has celiac disease. In South India, it's 1 out of 1,000. That makes sense. People in the South are more used to eating rice. People in the North are more used to eating wheat. Luckily, testing inflammation itself is pretty easy. You're looking for a number called Calprotectin on your stool test. If that number is high, it means there is inflammation somewhere in the gut. It could be because of alcohol, painkillers, infections, or celiac disease, meaning some sort of food-related inflammation. If you want to test for celiac specifically, you're looking for a slightly different number. It's called Anti-TGA. If that number is high, it means your body is actually fighting itself. I've made a separate video on how to think about celiac and how to deal with it called Celiac Explained. I've left the link again in the description for you. On to bucket number 3, hormones. Hormones are how your organs talk to one another. Some organs can tell your gut to go very fast, some organs can tell your gut to go very slow. Let me give you an example. When a woman goes through a menstrual cycle, hormonal changes influence her gut to work slow for a few days, then fast for a few days, and then normally for the rest of the time. For a girl who has PCOD or PCOS, this can be different. For a diabetic with a long history of diabetes, it can be different. So if you know your pattern in advance, you can actually plan and prepare to make sure that your gut doesn't feel disturbed or you don't feel uncomfortable on your worst days. One of the biggest hormones that affects how fast or slow your food moves through your gut is thyroid. And you'll find a number that matters in your thyroid profile as TSH. So if you've done your report recently, again, pause this video and go get your report. Open to the thyroid profile page. If you see high TSH, it's linked with slow movement of food and dry stools. If you see low TSH, it's linked with fast movement of food and unformed stools. Even normal TSH is not a green signal because the problem could be a little bit more downstream in something else called free T3 or free T4. So the next time you get a thyroid profile done, make sure it contains these 3 numbers: TSH, free T3 and free T4. An imbalance in any of these 3 numbers and it may explain why you've been having stool problems for quite some time. Explaining and improving thyroid profiles is out of our scope. Hormonal health requires genuinely specialized intervention, and there's a very large network of hormone specialists who can guide you with it. The point is, what looks like a digestive problem to you may actually be a hormonal problem. Fix the hormones and you'll fix your digestion. Honestly, there's far more than one video can hold. The role of gluten and dairy in IBS, food allergies, bile acid malabsorption. The list of things that can cause or trigger IBS is enormous, and that's a real problem. Usually, you'll find a specialist who is very good at solving one particular problem, but when IBS can be caused by 20, who do you go to? You don't want practitioners that are very good at one corner. You want practitioners that can see the entire map, and those are a little bit hard to come by. That's the problem we're trying to solve at thegutwindow.com. We're creating a discovery platform where you can get access to some of the best practitioners who have a history of dealing with patients struggling with these type of gut issues. You find the right practitioner and it might make your recovery journey much better and easier to manage. If anything in this video sounds like you, visit thegutwindow.com and see if you find someone that actually helps you make it easier. And if you're a qualified practitioner yourself and wants to get listed, reach out to us by registering on the link below. We'll take a look at your credentials and get in touch with you. Look, if you've been carrying some of these problems for a very long time, I really hope this video makes it a little bit easier for you to understand what's going on. Understanding it makes it easier to deal with it. If you haven't, I highly recommend you check out our next video on dairy and gluten. I'll see you in the next one.